Hello, my name is James, and welcome to NCLEX Test Taking Strategies Part 2. We are going to dive right into the material and start thinking about the nursing questions. First, you want to read the question carefully and focus on the data. Second, read every word. There may be keywords in the question that point you to the right answer. Also, ask yourself what or who is the subject. The question could be focused on a patient, a family member, a medication, or even a specific diagnosis. As you read, try to visualize the event too. In other words, picture yourself as the nurse in the scenario. Start thinking about which test-taking strategy may work as you read the question. Identify parts of the question such as case event, case query, question query, and the options available. Is the question a negative or positive query question? Is it asking for the correct response or the best response? Several keywords may be given in the question itself, so read them carefully. Next, we will identify more key test-taking strategies and give some examples for practice. When reading the question and the responses, look for strategic words or phrases. Strategic words or phrases may include items such as best, early, late, effective, first, priority, need for further teaching, most appropriate, or even increase, just to name a few. This slide shows many of the strategic words or phrases you may see on an NCLEX-style test. These are essential for choosing the correct response. You may even see a question where all responses are correct, but none of them is better than the rest. How do these strategic words or phrases look? Here are some examples. What is the nurse's best action? What is the immediate nursing action? What action would the nurse take next? Which response to the client is the most appropriate? What is the priority nursing action? Which statement by the student nurse indicated the need for further teaching? Another strategy to the test are using your nursing knowledge and applying the process of elimination. Relying on the process of elimination is not always going to help on every question. Other test-taking strategies and knowledge about nursing are very important to develop. Knowledge provides the basis for critical thinking to make clinical judgments. Removing options that are incorrect or do not relate to the subject is known as the process of elimination. So ask, what or who is the subject? After narrowing down a multiple choice question down to two options, it may be difficult to identify which one is best. In this case, reread the question, identify the case event and question query. Is it a positive query or negative query question? Look for strategic words or phrases, visualize what is being asked, try to place yourself in the position as nurse in the case given. With the data given in the question, what clinical judgment or cognitive skill will be applied? A lot of times, test takers read an option and apply the info to the question. Avoid doing this. Thinking what if may lead to the wrong answer, which we will discuss shortly. Read the options again, eliminate options if possible. Last, make an informed decision using nursing knowledge and test-taking strategies. Now we will dive into the what if part of the questions. Avoid reading into the question. If the information is not provided, it is likely not relevant. Focus on the information given in the question. However, there are some instances where specific diagnoses or medications have need-to-know nursing interventions that may go along with them. Read the question carefully. Identify strategic words or phrases such as most, likely, priority, increased, or verbalizes understanding of the instructions. Focus on the subject. Is the subject a person, intervention, a medication, a side effect, an outcome, or something else? With each question, you should be using your clinical judgment and cognitive skills to select an answer. Let's practice using some of these test-taking strategies. What's in question 1? A client newly diagnosed with diabetes mellitus is instructed by the primary healthcare provider to obtain glucagon for emergency home use. The client asks a home care nurse about the purpose of the medication. What is the nurse's best response to the client's question? So we're going to focus on the data, read every word, what is the subject, and visualize the question. Other things to consider are questions such as, what is the case event? Is the information relevant or irrelevant? What is the question query? Visualize the event again, and then look for strategic words or phrases. The answers to these questions will be highlighted on the next slide. The key words to question 1 are highlighted in yellow, and they are glucagon, purpose of the medication, and nurse's best response. The rationale that goes along with this is glucagon is used to treat hypoglycemia resulting from insulin overdose. The family of the client is instructed in how to administer the medication. In an unconscious client, arousal usually occurs within 20 minutes of glucagon injection. When consciousness has been regained, oral carbohydrates should be given. Lipoatrophy and lipohypertrophy result from insulin injections. A test-taking strategy here is to focus on the subject, the purpose of glucagon. Also note the strategic word best. Noting the word glucagon will assist you in determining that the medication contains some form of glucose. This relationship will direct you to the correct option. Give yourself a moment to look at the options listed here and see if you can select the correct answer. Using your knowledge about glucagon and why you would use it, see if you can eliminate several of the options. Remember, the question was, what is the nurse's best response to the client's question? If you chose option 3, then you were correct. Option 3 is, it is for the times when your blood glucose is too low from too much insulin. What's in question 2? The nurse is caring for a client who has a fever and is diaphoretic. The nurse monitors the client's intake and output and expects to note which finding. So again, we are going to focus on the data, read every word, what is the subject, and visualize the question. Other things to consider is, what is the case event? Is there relevant or irrelevant data? What is the question query? Visualizing the event, and looking for strategic words or phrases. The key words and phrases and relevant data are highlighted. They are caring for a client who has a fever and is diaphoretic, which means sweating, intake and output, to note which finding. The rationale that goes along with this is febrile conditions affect urine production. The client who is diaphoretic loses fluids through insensible water loss, which decreases urine production. However, the increased body temperature associated with fever increases the accumulation of body wastes. Although the volume of urine may be reduced, it is highly concentrated. Some fluid, but not the majority, will be lost through the skin. A test-taking strategy is apply the clinical judgment cognitive skill and recognize cues. Focus on the subject, care of the client experiencing a fever and diaphoresis. Think about the physiological response of the body to fever and diaphoresis. This will direct you to the correct option. Also remember that although some fluid is lost through the skin, the majority of fluid loss is not lost through this system. And review conditions that affect fluid imbalance. Tip for the nursing student would include fluid can be lost through the skin, the lungs during breathing, the kidneys, and the gastrointestinal tract. Most fluid is lost through the kidneys. If the client has a fever and is diaphoretic, the normal daily amount of fluid lost through the skin will be increased. The next section of our presentation is finding abnormal. Read the questions and responses carefully and look for abnormal information, such as lab values. In this question, look for anything abnormal. The nurse is monitoring routine laboratory values for a client who is taking digoxin. Which laboratory value requires the need for follow-up by the nurse? So start thinking. What is the case event? What is the question query? Visualize the scenario. With this question, the testing strategy is apply the clinical judgment cognitive skill, analyze cues. Note the strategic words need for follow-up. The first step in approaching the answer to this question is to determine if an abnormality exists. The client is taking digoxin. The laboratory's values noted in the options are all normal except potassium. Make connections between the data in the question and the options. Recall that the potassium level must stay consistent with the client is taking digoxin in order to prevent adverse effects from occurring. Remember to determine if an abnormality exists in the event before choosing the correct option. And then as far as need to know lab values, sodium is usually 135 to 145, potassium is 3.5 to 5.0, phosphorus is 3.0 to 4.5 milligrams per deciliter, and magnesium is 1.3 to 2.1 milliequivalents per liter. If you chose answer 2, potassium at 3.4 milliequivalents per liter, that is correct. Next, we will dive into the specifics of asking who is the client. We will do a review of client, family, and community exemplars as we dive into this question. The nurse is providing care to a Puerto Rican American client who is terminally ill. Numerous family members are present most of the time, and many of the family members are very emotional. What is the most appropriate nursing action for this client? First, who is the question focused on? And that is the client. We are looking for the most appropriate nursing action for this client. Start thinking about cultural competence and therapeutic responses. Several of the responses are neither and can be eliminated. Response 1 would be restrict the number of family members visiting at one time. Option 2, inform the family that emotional outbursts are to be avoided. Option 3, make the necessary arrangements so that the family members can visit. Or 4, contact the primary health care provider to speak to the family regarding their behaviors. In the Puerto Rican American culture, loud crying and other physical manifestations of grief are considered socially acceptable. Of the options provided, the correct option is the only one that identifies a culturally sensitive approach on the part of the nurse. Options 1, 2, and 4 are inappropriate nursing interventions. The answer is 3. Make the necessary arrangements so that family members can visit. Coming up is our next tip. When reading questions, try not to think, do I need to run for supplies? When answering a test question, all supplies mentioned in the options are available to you. Do not leave the client to gather supplies, and you have everything needed to provide quality client care. Continue to practice your test-taking strategies. What are the parts of the question? What strategy can you apply? And more strategies to come in Part 3. This concludes Test-Taking Strategies Part 2. Thank you for listening.